Hello, I'm Dr. John McDougall. Yeah, I appear pretty happy. Well, I'm a very fortunate person, but there have been times when I've been a bit depressed in the past, and I've looked for help and answers. And if you have depression and you look for help and answers, likely you're going to find a pill. Not to say that they aren't of some benefits for some people, but would you rather just kind of do some natural things to fix the problem of depression? This can be done. There are things that you can do that can control your mood tremendously. You've heard, for example, about running, how that produces a runner's high because of the endorphins that are produced in your nervous system. That's a very good way to help with depression. The other thing that you may have heard about is eating carbohydrates. There was a book that was titled Potatoes Not Prozac, and that was about eating a high carbohydrate diet to relieve depression. What happens when you eat a lot of carbohydrates, in other words, potatoes, rice, corn, and so on, you produce a lot of serotonin in your nervous system, and serotonin is anti-depression in its effects. There are other things you can do. In fact, the most important thing that I know of that you can do to relieve depression is to control your sleep. Don't get too much sleep. Sleep is depressogenic. I know you've been told it's beauty rest, and the more sleep the better. You don't want to get too fatigued and get in an auto accident. Well, there's something as having too much sleep. You can recognize this. Have you noticed that maybe on a Saturday or Sunday when you're off work, you slept in, the whole day went blue? Or do you remember back in your college days when you stayed up all night, you pulled all-nighters and you got manic? You can control your mood tremendously just by controlling the amount of sleep you get. What do I recommend? Well, I think 6-7 hours is about right for most adults. You can get less. That'll, of course, make you a little bit more manic. If you get more, you'll get a little bit more depressed. And then there's sunshine. Yes, sunshine. You know, the seasonal affective disorder, if you get more sunshine, you relieve depression. So here you have all these tools. Let's put them together. What you do is you set your alarm clock so you only get maybe 6 hours of sleep at night. You go to bed early so that you wake up early, so you take advantage of that sunshine. You go for a walk in the sunshine, and you come back and you have potatoes for breakfast. And then, after doing this for a little while, you look in the mirror, and what looks back at you is this very attractive, trim, healthy, energetic person. And wow, does that take care of depression. I'm Dr. John McDougall.